Pacemakers, a life-saving device for heart patients. Hello and welcome to our video about pacemakers. In this video, we will be discussing what pacemakers are, why we may need them, the types of pacemakers, the pacemaker implantation procedure, incidents, risks, and what it is like to live with a pacemaker. What are pacemakers? Pacemakers are small electronic devices that are implanted into the chest to help regulate the heartbeat. They are used to treat a condition called arrhythmia, which is an irregular or abnormal heartbeat. Pacemakers send electrical signals to the heart muscle to help it beat in a regular rhythm. When do we need pacemakers? Pacemakers are used when the heart's natural electrical system is not functioning properly. This can happen due to aging, heart disease, or other medical conditions. People who have a slow or irregular heartbeat, heart block, or other heart conditions may require a pacemaker to regulate their heartbeat. Types of pacemakers. There are two main types of pacemakers: single-chamber pacemakers and dual-chamber pacemakers. Single-chamber pacemakers have one lead that is placed in the right ventricle of the heart. Dual-chamber pacemakers have two leads, one in the right atrium and one in the right ventricle. Dual-chamber pacemakers are more advanced and can better mimic the natural electrical signals of the heart. The pacemaker implantation procedure. The pacemaker implantation procedure is typically done under local anesthesia. A small incision is made in the chest and the pacemaker leads are guided through a vein to the heart. The pacemaker is then implanted under the skin of the chest and connected to the leads. The procedure usually takes about an hour and most people can go home the same day. Incidents. While pacemaker implantation is generally safe, there are some incidents that can occur. These can include infection, bleeding, or damage to the heart or blood vessels. In rare cases, the pacemaker leads can dislodge or break, requiring additional surgery to fix. Risks. Like any medical procedure, there are risks associated with pacemaker implantation. These risks can include infection, bleeding, bruising, or damage to the heart or blood vessels. In rare cases, the pacemaker leads can dislodge or break, requiring additional surgery to fix. Living with a pacemaker. Living with a pacemaker is generally safe and should not limit your activities. However, there are some precautions that you should take. Avoid magnetic fields, such as those produced by MRI machines, as they can interfere with the pacemaker. Be sure to tell your healthcare providers that you have a pacemaker before undergoing any medical procedures. Regular follow-up appointments with your cardiologist are also important to ensure that the pacemaker is functioning properly. Conclusion. Thank you for watching our video about pacemakers. We hope that you now have a better understanding of what pacemakers are, why they are used, the types of pacemakers available, the implantation procedure, incidents and risks, and what it is like to live with a pacemaker. If you have any questions or concerns about pacemakers, be sure to speak with your healthcare provider.